and we have to rule out the presence of Meckel's diverticulum. Clear, guys? Now, what is the problem in Meckel's diverticulum? You know that there is presence of ectopic mucosa. So this is the diverticulum. You can see here, and here there is presence of ectopic mucosa. So you must be knowing that what is that ectopic mucosa? It is gastric most commonly, followed by pancreatic, followed by colonic. If there is gastric mucosa, so obviously this gastric mucosa is secreting what? It is secreting it. Yes, it is secreting acid. And because of this acid secretion, what will happen? Patient is going to develop ulcer. So since there is acid secretion, there is development of ulcer. And if there is development of ulcer, so obviously what will happen? From this ulcer, bleeding will start. Clear? So what is the most common symptom of Meckel's diverticulum? You can see the most common symptom, it is bleeding. Most common symptom, it is bleeding. Now, what is the most common symptom in adults? See, any patient who is having ectopic gastric mucosa, that patient will be having ulcer. And if ulcer is there will be bleeding. If patient is not symptomatic during childhood, it means what is not there? There is no ulcer, it means there is no ectopic gastric mucosa. So, adult patients they develop abdominal pain sometimes because of intussusception, because you know that Meckel's diverticulum it's a lead point. You know that Meckel's diverticulum it's a lead point for intussusception. So because of this, there can be abdominal pain. Sometimes because of diverticulitis, there is abdominal pain, and sometimes there is a band. What happens? There is a band connected from here. So band is connected from diverticulum to the umbilicus. Clear? And it is going to twist or it is going to turn. It leads to volvulus. So three things. Intussusception, there can be diverticulitis and there can be volvulus. Because of this, patient is going to develop what? Abdominal pain. Clear? So what are the causes of abdominal pain we discussed? Midgut volvulus, intussusception and diverticulitis. Okay? Now coming to the investigation. Let me tell you basics. Usually, for anatomical disorders of GIT, we go for barium study. If patient is having esophageal diverticulum, we go for barium swallow. If patient is having gastric diverticulum, we go for barium meal. If patient is having small bowel diverticulum, we go for enteroclysis or barium meal follow through. And if patient is having colonic diverticulum, we go for barium meal. Clear, guys? But what is the unique thing in Meckel's diverticulum? Unique thing is presence of ectopic gastric mucosa. So since there is presence of this gastric mucosa, we have to detect it. And if there is this gastric mucosa, how we can detect it with the presence of which investigation? Technetium per technete scan. So by technetium per technete scan, we detect gastric mucosa. One question. Second question, imagine a patient in whom there is an absence of ectopic gastric mucosa. So obviously you cannot detect it by technetium per technete scan. So just like any other small bowel diverticulum, you can diagnose this condition. You can diagnose this condition by what? Enteroclysis. Clear? So you can diagnose this condition by enteroclysis. So if there is gastric mucosa, we diagnose it by technetium per technete scan. And if there is absence of ectopic gastric mucosa, we detect it. So investigation of choice, that is enteroclysis. Clear, guys? Now coming to the treatment. Two situations are there. Imagine first one. Patient is having unhealthy base. See here, there is presence of ectopic gastric mucosa. So the patient is having ectopic gastric mucosa. Because of this, what will happen? There is ulcer here. And if there is ulcer, in that case, apart from the diverticulum, I have to resect the bowel also. So this is what resection and anastomosis. So patients who are having unhealthy base, patients who are having unhealthy base, in that case, what we go for? We go for resection and anastomosis. And the patients, here you can see this, here, there is no ulcer, there is healthy base. So you just excise the diverticulum. In surgery, if you excise something, that is ectomy. Like you excise spleen, splenectomy. You excise appendix, appendectomy. You excise gallbladder, cholecystectomy. If you give incision on something, that is otomy. Like you give incision on small bowel, enterotomy. On CBD, choledochotomy. On fistula, fistulotomy. Got it? So here we are just going to excise the diverticulum. And if you just excise the diverticulum, this is known as what?
Diabetic.
Diverticulectomy. Clear? So important point, make a diverticulum with healthy base, we go for diverticulectomy. And make a diverticulum with unhealthy base, we go for resection and anastomosis. Clear guys? Now, suppose any patient is having Meckel's diverticulum. Clear? What are the factors which are going to increase the risk of complications? So if there is narrow mouthed, if there is unhealthy base, and if there is presence of ectopic hysterectomy, all of these are going to increase the risk of complications. Clear guys? So this was Meckel's diverticulum, a small topic but very very important topic. Thank you listeners. Thank you very much for giving me
Thank,
this opportunity to present this. Thank you.
thank you, sir.
Thank you so much, sir, for giving us opportunity to hear like you in this way. And at the end, this was our last speaker, and I will request again, and it's last time, please, as the honor of you, sir, I will I will pass the immense gratitude from all our institute management and the parliament for joining us, sir. Thank you so much, dear blessed.
Thank you.
Thank you so much, sir. Dear audience, our guests, and respected chairpersons, we have finally come to the conclusion of our two-day International Annual Conference on Science and Medicine. Patience, persistence, and perspiration make an unbeatable combination of success. If you need a better future for yourself, you need to work hard on your present. You don't need to compete against anyone. The only competition you have is you yourself. If you are better than who you were yesterday, it is indeed a win-win for you. I would like to invite Dr. Danyar sir to kindly come and address the audience for concluding remarks of our conference.
-2 कहाँ जा रहे हैं?
Good evening, everyone.
Good evening, sir.
Let me introduce myself once more, if you forgot. My name is Shankar Danya. I am histology teacher. Department is morphological disciplines.